tackling racism and recognizing it as a public health issue is really beneficial for everyone. Even if you might think that you're far removed from this or you haven't experienced racism or discrimination, this affects you too, because anything that kind of makes our healthcare systems unfair, but also, racism makes our healthcare systems inefficient. It wastes time, money, and resources.
This week, I'm sharing the second part of my conversation with Layal Liverpool, who is an author and science journalist specializing in virology and immunology. Now, Layal has worked as a biomedical researcher at UCL, the University College London, and also at the University of Oxford. Her writing has appeared in Nature, New Scientist, Wired, The Guardian, and a bunch of other places. So she was a really interesting guest. This was an incredible conversation. In this part, you're going to hear us talking about the impact of racism on maternal health. We talk about the role of race in healthcare, and we talk about the impact of things that are systemic, that might not be intentional, but simply because of the way society is structured can result in certain externalities and negative health outcomes for people of different genders, people of different races, etc. We also talk about this concept that I heard of and I was a bit wary of, called environmental racism, but there is so much that actually makes a ton of sense when you dig into it. And so you're going to hear us talking about that and breaking that down. We also talk about the gaps that exist in healthcare outcomes, education outcomes, and other systemic challenges that are present within society. And then finally also about how racism can affect mental health outcomes. So Layal has a wealth of incredible information to share. You can get the full show notes, the transcript, and read my newsletter at theknowledge.io. And you can find Layal online on Twitter at Layal Lives. We'll have the links to her website and book below. If you love this episode, please do share it with a friend. And don't forget to leave a review wherever you listen to podcasts, because it helps us tremendously to find other listeners just like you. Maybe to crystallize that, I'd love if you could expand a bit more on the example of maternity, which you've given, and I know you've also just had a child yourself. When people talk about this idea of, Black women are potentially more likely to die during childbirth, or they're more likely to have some of these negative outcomes during the maternity period, what exactly are they talking about, and where do some of those things come from?
I think it's actually a good example because in theory, maternity, it's not an illness. You're not sick, you're pregnant, and that should be a state of health. And we should be helping and supporting, women and birthing people to go through pregnancy in a healthy way. But unfortunately, as you say, there are inequalities in the UK, but also in the US and in other countries. We see that there are biases. Actually, I mentioned the grassroots organization 5 Times More here in the UK. They have been doing really amazing work in this area. For example, they've published guidelines to support Black women and birthing people in advocating for ourselves in the healthcare setting. And I think that's really great. It's obviously super if you can be informed and know your rights in a healthcare situation. But I also think that we shouldn't put all the onus on, people who are discriminated against to solve these problems. There also needs to be work done, for example, within healthcare, within medicine. And 5 Times More has also been helping with training resources for people working in healthcare so that they can, learn about these issues and make sure that they're helping all people who they see. But I think also more widely, a lot of the issues that affect our health generally are also affecting maternal health. So maybe an example is thinking about health as something that doesn't start from the moment that we just, arrive in the doctor's office or we collapse maybe and we're going to the emergency room. It's something that starts way before, it's like, you wake up in the morning. What do you eat for breakfast? Where do you live? What kind of air are you breathing? How does that affect your health? And those things are often correlated with race because of racism. And so it's important also that we think about how those things are affecting our access to healthy living, to, for example, healthy food environments. We see also racial inequalities here in the UK, but in other countries as well, in terms of what kind of food you have access to, whether you have access to green space to exercise. So in England, for example, there's evidence that ethnic minority groups are less likely to live close to green space. They're more likely to live in environments where unhealthy food options dominate over healthy ones, but also just something as simple as the air we breathe. We see inequalities. People of color in England are more likely to live in a very highly polluted area. In the book, I highlight the really sad story of Ella Kissy Deborah, a young Black girl in London who died in 2013 at the age of just 9 because of exposure to air pollution in the environment where she lived in London. she developed a really severe form of asthma. And again, this is a single story, but it's reflected in statistics. We see that Black children like Ella, Black adults and people from Asian ethnic backgrounds are more likely to be hospitalized with asthma in the UK. And so you see that sometimes these patterns of inequality that have been driven by legacy and history of racism continue to lead to inequalities in health today. And I think that also affects maternal health, because if you're going through pregnancy, obviously you want to be leading the healthiest life that you can at that time and in general. And if your access is already reduced before you even become pregnant, you're already seeing inequalities. Before pregnancy, we see disparities in miscarriage. There was a study that looked at several countries, including the UK, that found that Black women are more likely, I think 43% more likely to experience early pregnancy loss. There are also inequalities when it comes to accessing fertility treatments. So even before pregnancy, we see these problems. And then I think during pregnancy, that's just kind of compounded because of all the health effects that we see there.
Okay, sure. I want to come back to the point you mentioned about climate change, or, the environment and how that can have impacts on our health in a bit. But just to ask another question about this, the maternity factor, I am interested to know your thoughts on, is there an extent to which this can also potentially end up being self-reinforcing? And if so, is there an extent to which we can untangle that? And I ask that because I can't tell you, and I'm sure you probably have experienced this yourself, how many Black women that I know that have this, premonition about being pregnant, and this almost a fear, because they are aware of these statistics and because they have this awareness of the differences in health outcomes for Black women, being pregnant, which maybe other races might not have. And there might be a potential that actually, if you're already having this fear about going into this period, you're already thinking about it, I can't imagine, the extent to which that might create additional stress. It might affect your heart pressure. It might affect you in a bunch of other ways. And it's not even, nothing has actually happened yet, but it's just because you're aware that this thing is out there and there's a potential that your health outcomes could be worse. And so in a sense, that could already start to affect you even before you go into that period.
Yeah, and there is also research looking at this, that not just in maternity, but in general, even the perception, or let's say the anticipation of experiencing racism, can be harmful to health. And I think that's another aspect that we should think about when it comes to when you are living in a society where there is racism, how that can affect your health even before you might experience, an acute instance of that. And I think that is a big problem. When it comes to maternity, I can speak from my own experience that I was actually researching and editing the book while I was pregnant. And that was something that was really difficult for me. And at some point, I really had to kind of step away from some of these statistics because it is really worrying. And of course, you want to do the best to protect yourself and your child. So I completely understand that. I think people should take care of their mental health in dealing with these things. Unfortunately, can't escape from the realities that there is racism around. And I think that's why it's important that all of us recognize this as an issue that we care about and that we can do something about, because then you're helping those around you. And in the book, I also make the case that tackling racism and recognizing it as a public health issue is really beneficial for everyone. Even if you might think that you're far removed from this or you haven't experienced racism or discrimination, this affects you too, because anything that kind of makes our healthcare systems unfair, but also, racism makes our healthcare systems inefficient. It wastes time, money, and resources. Here in the UK, people have probably experienced, waiting times with the NHS and these problems. And I think if we can remove bias in that setting, that will be beneficial for all patients and anyone who is, for example, pregnant or has other reasons that they are engaging with healthcare. But yeah, I do think we need to also be careful about these conversations. And I think it's very important to gather data when it comes to documenting racial inequalities in health, because that, of course, enables us to take action, to tackle the problem. But I think we should be careful to make sure that we're not just gathering data, we're not just documenting inequality, we are actually then translating that into policies that can tackle that. Because again, we don't want to treat this as something that's inevitable or permanent. This is something that we can change, that we can do something about. So I do feel optimistic in terms of the future, that by recognizing these inequalities, it does mean that we're already on the way to changing them.
Do you have any idea of how we can get around the inherent subjectivity of, I think one part of it is the question of racism itself. And, how do you know if I'm experiencing something, and maybe this is coming from this kind of place, or it's just coming from maybe some incompetence, or, how might people be able to navigate or separate those aspects? But then simultaneously, you also have the subjectivity on the part of the medical person, where, as we talked about, there's this idea of some race-based medicine where actually someone is thinking perhaps, and they're not thinking, I'm being racist. They're thinking, this is just something I've heard or something I've been told.
Yeah.
This Black person, if they are subjectively rating their experience of how much pain they are going through, how much medication should I give them? How much painkillers should I give them? If they are telling me, they're feeling this much pain, should I discount that because, I think maybe they're exaggerating or something like that? Because that comes at it from both sides. How do we balance the inherent subjectivity of that compared to, there are some things where maybe it can be quite objective and it can be maybe a lot more obvious, but in this type of area, I think that's potentially what leads to some of these health outcomes or people dying or things like that, because it's one person saying, this is how I feel, or this is what I'm going through, and then someone else deciding how seriously to take that.
Yeah, and I think racism is difficult to measure or to assess. So I think it is a difficult thing to study, but I think we shouldn't shy away from that. I think we should try to understand these problems because we know that this is affecting patients. This is leading to worse outcomes for people. And I think you gave the example of pain. I mean, there is also research that can document this to an extent. So there's a study in the US showing that Black patients, for example, are 40% less likely than white patients to be given pain relief in emergency rooms in the US. And then there are myths about pain that we've talked about, but they also affect people in other countries. There was a study of people living with Parkinson's disease here in the UK, which found that Black people receive less pain relief compared to white people, even when they're reporting similar levels of pain in a questionnaire. Again, pain, of course, it's difficult to measure, and we're relying on people sharing their experiences. But I think that's something that came through to me in the book, is that beyond these statistics, a lot of people who I interviewed who shared their experiences of racism in a health setting felt that they just weren't listened to, or that their experiences were dismissed. This is a particular theme for Black women, women of color, who just felt that they weren't listened to. And I think it really struck me that this seemed to be happening at kind of all income levels, let's say. So I think a story that many people may have heard is about Serena Williams, who also experienced discrimination in the context of her childbirth. And I think what really struck me about her story is that, Serena Williams is a very successful athlete. She's wealthy. She has access to good healthcare. And she has also spoken of her privilege in that situation and said that, she's lucky that she survived and everything was okay because she was able to afford that kind of good care. But she said that, when she tried to advocate for herself, she wasn't listened to until eventually it turned out that she was experiencing, a blood clot in her lungs that was very dangerous. And unfortunately, action was taken eventually and she was okay. But she said, doctors aren't listening to us. And I think it's an important point about listening. There is also research, not just looking at racism, but in general, looking at how important listening is, that when patients feel listened to as well, that leads to health benefits. And I think that also links to maybe how our expectations about our health can affect our outcomes. So I think this shouldn't be dismissed. Even though racism can be difficult to study, I think we should persist and try to understand these interactions. And there is also great work looking at how this leads to also physical outcomes. Like there's even efforts to look at the impact of racism on the brain, for example, linking experiences of racism and trauma in early life to dementia later in life. And again, I think this is so important. Dementia is a condition that is increasingly affecting huge numbers of people around the world. The prevalence is only growing. And if we can understand how racism contributes to that, how it might be leading to more cases or worse outcomes for people, then it means we can help more people, I hope, and just tackle this problem in health and beyond.
Hey, we'll get back to the episode in just one moment, but I wanted to tell you very quickly about my newsletter. I started sharing everything I was learning online, and a few thousand people came along for the ride. I send 3 regular emails. Brainwave, fortnightly on a Tuesday, which is about the intersection between technology, philosophy, and psychology. Then every week on a Thursday, I send Revelations, and that's about creativity and productivity. And then finally, every other weekend, I send Wayfinder, and that's about decision making. So people in the audience actually send me really tough problems that they're working through, and I help to deconstruct them using mental models and decision making frameworks. So if you'd like to subscribe, you can join me and over 20,000 incredibly driven people at theknowledge.io. Okay, back to the episode. There was another example that I wanted to unpack specifically because I think it's a brilliant microcosm of the duality that we're talking about here. And it's non-medical, which I think is also useful.
Hmm.
And I think it's something that you wrote about a few years ago, which is about the NFL race norming formula. And so
Hmm.
essentially, what had been the case is that when players in the NFL were bringing lawsuits against the league for brain trauma that they may have suffered, they're getting CTE, things like that. Part of the formula that the NFL is using to calculate, or at least was using to
Yeah.
calculate how much they might have to pay out in a lawsuit, is they're adjusting it based on race. And there's something implicit in the formula that says, oh, if this is a black person, we are just going to assume that they already have, some subpar cognitive functionality. And so because of that, then we can actually just discount how much that we're going to have to pay them out, which seems insane. And on the surface, I'm pretty sure that if I just took that set of facts, if I just said that to a bunch of people on the street, or if you just said that, in those terms to someone that worked in the NFL, maybe a league owner or something like that, they might say, oh, that sounds terrible. That sounds racist. Like the idea
Yeah.
that, oh, if this person is black, I'm just going to assume they have subpar function, cognitive function. And so if I'm calculating how much I'm going to pay them, I'm just going to pay them less because, their brain
Yeah.
power was already impaired anyway. And if they sustain these injuries, maybe it's not so much my fault. That seems insane. But somehow, for a very long time, people were just applying this, the lawsuits were being brought. They are doing this race norming. And another important thing, they're just eyeballing it, right? There's maybe a lot of mixed race people in the league,
Right.
or people that have different ethnic descents. And the idea that someone is just looking at you and saying, do I think this person is black? And if I think they're black, then the formula says this is not a subjective, well, at least the formula is
Hmm.
not a subjective thing. It's, oh, if I think they're black, then we're just going to discount the amount that we're going to need to pay them. And that's just what it's going to be. And that seems crazy to me, that
Yeah.
people that if you spoke to them on the street separately in some other context, they might say, oh, I'm not racist. I have nothing against black people. They might not have any of those beliefs whatsoever, but then simultaneously they are also applying something that seems on the surface just extremely racist.
Yeah, absolutely. And I think it's interesting that you said, oh, this is a non-medical example. But actually, I interviewed a neuropsychologist based in California, I think in the days after the NFL kind of got in trouble over this, and the NFL said, we're going to stop using race norming to adjust players' test results. And this neuropsychologist told me that actually this idea of race norming comes from medicine. So it comes from neuropsychology, and it was an effort to correct for observed differences in cognitive test performance between Black and white Americans in the last century. And again, the evidence shows that those differences in cognitive test performance are caused by, again, racism, in fact, and inequalities in access to education, opportunities, even the test setting not being suited for people depending on their background. There's lots of evidence essentially that there are inequalities that lead to these differences in test performance, but somehow that had been kind of interpreted as, oh, okay, Black people's brains are inferior or work differently. And I think you touched on this earlier, that there's a whole, a lot of worrying pseudoscience trying to justify this idea of racial differences in intelligence. But having that embedded into a medical calculator, which really affects people's outcomes, which the NFL then adopted because in their case it was beneficial because that reduced the number of payouts that they had to give to Black former players. It's really worrying because this could affect people beyond just, I think the NFL exposed the problem because there's a lot of attention on American football. But what struck me is that this doctor said, no, these are widely respected norms within the field of neuropsychology in the US. And so these are being applied to patients in general. And as you said, people might not even know that this is being applied to them. It might be based on the doctor's perception of their race or them being racialized in a certain way. And that can lead to worse outcomes for people because it essentially assumes that, Black people start out at a lower level of cognition. And so they need to have reached an even lower level, relatively speaking, compared to a white person to qualify for a diagnosis of dementia or of, CTE or brain injury. And that's important because diagnosis is the key to get treatment, to get help, to get support. And yeah, these conditions affect more and more people. So I think it's beyond the NFL. We should be looking at medicine, which is where a lot of these ideas come from. And again, question, where is it coming from? Does it still make sense to have such guidelines? Who is it benefiting? Who is it harming? Because this is really problematic. And it's an example that, was very disturbing to me as well when I learned about it.
In thinking about how some of that is resolved. It actually pulls my mind back to the maternity example. I know that there are some people who might say, oh, actually, I want to have a black midwife if I'm, going into the ward or something like that. And I know that some people will then also have this fear. And now I'm not so much thinking about black people of,
Mm-hmm.
it's been common in the news now, people talking about this DEI problem. And actually,
Mm-hmm.
as we are trying to correct some biases in representation in
Mm-hmm.
certain fields, there is a fear that, oh, this also means that actually we're going to be introducing some subpar people, and people that are underqualified may just get jobs simply for the fact that we need more representation. And there's a supposed idea that there needs to be more people from different races in certain fields. And that is kind of diluting the quality of people that are, professionals. How do you think about that factoring in?
Yeah, I think it's an area where there also has been some research, more in the US, but looking, for example, at physician-patient race concordance. So what's the impact if the race of the physician matches that of the patient in terms of health outcomes? And there is evidence in the US where obviously there's a particular context of racism against Black people that having a Black physician can lead to better health outcomes. For example, there was a study looking at cardiovascular outcomes for Black men in California, which found that those Black men had better outcomes when they had a Black physician compared to a non-Black physician. We've talked about racial inequalities and maternal mortality, but there are also inequalities when it comes to infant mortality in the US, but also in the UK. And research in the US has also shown that Black infants had better outcomes when they were cared for by a Black physician. And I think that work it highlights, I think, an important issue that it is beneficial when we have physician workforce or a healthcare workforce that reflects the population that they're caring for. But I also think that, all physicians should be able to take care of all patients. All doctors should be trained, for example, to recognize conditions on diverse skin tones. There is evidence that there are problems with that. So, for example, there was a survey of users of an international medical teaching platform, which found that only 5% of the medical professionals surveyed said that they feel really confident diagnosing conditions across, a diverse range of skin tones. So I think things like that are really important to tackle, because we can't just say, okay, everyone should be matched to have a physician that is of the same race. I also think when we think about those outcomes, when it comes to physician, patient, race matching, let's say, I think a lot of that is more about trust and about being competent to care for people rather than about the race. So I think what people want is to have a doctor who listens to them, who they can trust, who they feel is treating them, equitably, fairly. And I think that is more important than necessarily them needing to be the same race. At the same time, I think that there's inequality in access to jobs and opportunities. And there are a lot of very talented people who could be, qualifying as doctors and taking care of people. And I think it's good to see increasing representation and opportunities for people at all levels in medicine. Something I hear a lot from people here in the UK, people will say, oh, but the NHS is extremely diverse, which is true. Healthcare workers in the UK are from diverse backgrounds. There's really good ethnic minority representation in the NHS. But when you look into the data in more detail, you see that there are inequalities. So, for example, Black people are underrepresented when it comes to being the most senior doctors in the NHS, so consultants. And there is an impact of seniority and hierarchy in these organizations, that having representation at a lower level is, of course, important, but it's also important that we see that at the top, because I think that affects the culture and the practices in that organization. So I think there's still a lot of work to do in terms of improving representation, diversity in healthcare. And I do think that that will be helpful. And I do not think that that means you're compromising on quality at all. I think that's a common misconception. In fact, there are many talented people, many smart people out there. It's more about just giving people the opportunity to pursue a career that I think is very admirable. I really admire people who work in the healthcare profession. It's a caring profession. Most of the people who I've interviewed and talked to who work in this field really do care. They care also about racism and how that affects their patients. So I think it's just amplifying that and increasing the work in this area to ensure that all patients can access that kind of care where they feel listened to, where they can really trust the person who's looking after them in the healthcare setting.
What do you think is the balance of the extent to which this is something needing to be solved, let's say within the medical profession versus perhaps at a policy level in general? Because, I mean, one, I think that's a distinct question in itself. But then I also can imagine how there are some knock-on effects where, for example, when we think about the NHS in the UK, if the government has certain policies around that affect the number of doctors that you have and the number of new people being trained, how does that then trickle down into, okay, how much time do doctors actually have to evaluate different kinds of patients, and what shortcuts might they take, and how might they, make certain choices differently because they are understaffed, and things like that they might not make if there were more doctors or different types of doctors, etc.
Yeah, I think there are a lot of pressures working in healthcare. It's a really difficult profession. In the UK, for example, we know that there are enormous pressures on the NHS. People are also underpaid. And so I think tackling those problems will be really important in terms of tackling racial health inequalities and supporting, healthcare workers with resources like education to diagnose conditions and diverse skin tones, being aware of how racism affects patients' health. I think this is something that would be really helpful. And I think a lot of healthcare workers who I've spoken to would love this, that they're really in favor of getting access to more of that information and education. Again, I think this is an issue that people really care about in the medical profession. But to come back to your point about, are these more problems in medicine or in wider society? I think definitely it's both. And I actually think wider society is the most important thing. As I mentioned before, our health doesn't start from the moment that we arrive in the doctor's office or in the clinic. It's to do with how we live our lives and what opportunities we have to live the healthiest lives that we can. And we know already that in society, there are huge inequalities, economic, environmental, that make it more difficult for certain groups of people to access healthy living. And so I think those are problems that we definitely need to tackle. I mean, we're coming to a general election. I'm not going to get into commenting on politics or things like that, but I do think we should just keep these things in mind when we're thinking about voting and, how are we going to make sure that we're tackling inequality in society as a whole to then ensure that everyone has the opportunities to lead healthy lives. And again, this is an issue that I think everyone should care about, because if society is healthier, that's beneficial for all of us. I think we saw that really demonstrated with COVID-19. Racism or other inequalities act as kind of fault lines in our society through which problems and infections, pandemics like COVID-19 can kind of creep in. So no matter who you are, this is something that can affect you ultimately. Viruses don't discriminate. Eventually, if there are inequalities that result in the spread of infections or result in worse health or pressures on the healthcare system, that's going to affect everyone.
One of the last things I wanted to come back to is something you touched on before, which is this idea of, some people refer to it as environmental racism. And I can admit, even I think the first time I heard someone say that climate change is racist, even I was a bit like, okay, it sounds like you're kind of over-egging something here, or, what exactly are you talking about? And it sounded a bit silly at first. And then the more I thought about it, actually, intuitively, it does make a lot of sense. And I can give a perfect analog that I think of, but I'd love for you to be able to unpack it, the idea properly, even for me, because I must admit, I'm not super familiar with exactly what that entails, but the part that comes intuitively to me, I can think of one example, which was actually from China. This is now a number of years ago, but it was just a very interesting study where I think they were looking at this. I think it was like a village or a town or something like that. There's a river that goes through it. And so you can look at the population on one side of the town and the population on the other side of the town. And they had noticed at the time that there was this disparity in the grades, the attainment scores for students. And so on one side of the river, students seem to be doing a lot better than students on the other side of the river. And people came up with loads of different hypotheses about why that might be. Okay, maybe on this side, I don't know, things are just better. There are some better schools here. People might want to move to this side of the river and things are slightly better here. But it also turned out, and this is quite a small town, there was a factory on one side of the village that was putting out some pollutants. And at some point, they just removed the factory, and then you can look directly at the before and after of attainment scores for children on both sides of this river, where the factory was and where there was no factory. And suddenly, as soon as you take away the factory, the air quality starts to improve, the number of pollutants starts to decrease, and suddenly children start doing a lot better. And you didn't change anything else about the education policy. You didn't change anything else about the level of schools, level of teaching, anything else. But suddenly, you suddenly have much better outcomes for students simply by making this one change. And I think that's the part that comes intuitively to my mind when people talk about, okay, how might the environment also have some racialized outcomes where perhaps you might have different levels of investment in different areas, or you might have different levels of regeneration in different areas. Is that accurate? How accurate is that based on what you know?
Yeah, I think that it's clear that there are huge, environmental inequalities, and often this does fall on racial or ethnic lines. That when there are groups in society that are marginalized, often this means people are living in specific neighborhoods. And as you've given the example of pollutants in the environment, and that's a huge thing. In the US, people of color are more likely to live in areas affected by environmental contamination. We've talked earlier a bit about air pollution. I mentioned in England, for example, people of color are more exposed to air pollution. In the US as well, there's research showing that Black and Hispanic people actually contribute less to the production of air pollution, but they're still more exposed to it. And we know that air pollution is harmful to health, affects the lungs, increases risk of asthma and other things. But we also see this with other things, like, for example, climate change on a global scale. It's very clear that there are massive inequities in terms of who's affected by that. Often Black and brown people in the global south are disproportionately impacted. But even within, wealthy countries like here in the UK or in the US, there are inequalities. So in the US, people of color are more affected by what's called the urban heat island effect. So living in neighborhoods that have less trees to create shadow and, release moisture, that makes it much more difficult to keep cool in hot weather. And I think heat is something maybe it isn't perceived as a health threat, but it's really can be really deadly. There's research showing that rapidly rising temperatures have exposed vulnerable populations to 3.7 billion more heat wave days in 2021, for example, compared to every year between 1986 and 2005. So we already see that change in quite a short time scale. I think we need to be thinking about those sorts of inequalities, how we're making it harder for people to lead healthy lives just in the environments they live before they might develop an illness where they then need treatment and care. And then when it comes to accessing healthcare, we also see inequalities in terms of where people live. In the US, for example, there's issues with access to, for example, maternity care. Just simply where people live means they might not live close to a maternity ward because there have been a lot of closures of maternity wards in Black neighborhoods. So there are just examples like that where our living environment affects the air we breathe, water we drink. I was actually, as you were talking, I was just looking up in the book, I mentioned the issue of lead poisoning. So young children are particularly vulnerable to lead poisoning, and it can really cause permanent damage to the brain, to the central nervous system. And there was a study in the US showing that poor Black children are especially at risk. So there was a study showing that Black children living below the poverty line were 4 times as likely to have elevated levels of lead in their blood compared to white children living in poverty. So even there, where you're looking at a situation of already economic inequality, which definitely is something we need to be tackling. On top of that, you have racism and the history of racism that affects, where people live and what they're exposed to. So I think we really need to be thinking about that. I think that's arguably the biggest, factor that is contributing to inequalities is just where we live and what we're exposed to, which unfortunately is very much correlated with our race because of racism.
Yeah, I think this is actually, everything we've talked about is extremely interesting, but this is actually extremely interesting and so pernicious in a sense, because it really is something that can so easily fly under people's radars. And you often hear people talking about, oh, pull yourself up by your bootstraps, and oh, if these people can work, then these people can work. And it's just incredible that even if you take away, the individual experience, just the fact that you live in a certain type of area will have so much of a dramatic impact on your life outcomes in a lot of different ways. Like you mentioned the example of, okay, literally, when you imagine the difference between perhaps the inner city and the suburbs, just the fact that you have more or less trees in a particular area can impact the amount of heat that you feel, the number of hot days that you have, and how that can affect you. And also, I know there's been studies on, I think the UK in general, and also specifically in London, where, and this is just generally, on the impact of air quality on children's exam results. And on the days that in London, there just happens to be lower air quality, children perform worse on exams. And I know that that's not necessarily something that test takers take into account, and they say, oh, actually, air quality is pretty bad today. Maybe we should move everyone's GCSEs up by a day. But just the idea that has an impact, then you can also think about, okay, for people that live in areas that have lower air quality, how might that impact their homework, their studying, their day-to-day lives, even outside of school, and everything else that happens before the exam day? Like, that is already something that's affecting them. And funnily enough, something that you were saying also brought to my mind this example, slightly, kind of health related in a sense, but you'll understand where I say it. One example that relates to what you're saying is also like food deserts, right? So in certain
Hmm.
areas, there's not many resources, there's not enough stores, things like that. But
Yeah.
one study I found really interesting, I think it was Malcolm Gladwell that was looking at this, was people very often reference this idea that in certain black neighborhoods, there are a lot more, the homicide rate is higher. There are a lot more people that die from certain kinds of things, blah, blah, blah. And what
Hmm.
was so interesting is they did the study and they looked at it twice, where actually there is a distinct difference between the homicide rate and the gunfire rate. And so what that means is, okay, if you look at how many like shootings were there versus how many people died, there is a drastic difference. And then you can take that map of places where shootings happen or someone got shot, and then you can overlay that map against where are the hospitals and where are the ICUs. And then I think they were looking at Southside Chicago as a specific example where actually, if you can only take someone with a gunshot wound to these 3 ICUs, and all of them happen to be in wealthier areas because you have to pay, those wealthier areas are also whiter areas. And so actually, if someone gets shot over here in an area that is, that has
Lesser
less
resource.
resources, that has disproportionately more ethnic minorities or black people specifically, it's going to take them longer to get to the hospital and to get treatment. And simply because it's going to take longer to get someone that's been shot to a hospital, they are more likely to die. And so the homicide rate is almost guaranteed to be higher. And so it's just this idea that simply because of how we design our neighborhoods and how we design our cities, and simply because of the way different people live in different areas, that in so many implicit ways affects their health outcomes that we don't even realize on the surface. And it's so easy to point to the easy excuse and say, oh, these people must just be killing themselves more. Well, actually, no, like if you put some hospitals in this
Yeah,
specific
absolutely.
area, some ICUs, how much might that change people's health outcomes?
Yeah, I think that's actually, I wasn't aware of that example in that detail, but I think it's such a good point that it's access to healthcare is really important, and having just the resources that we need to live healthy lives. You often hear discussions about, oh, we need to educate people, we need to teach people how to be healthier, which can feel a little bit patronizing, like, as if it's like, oh, people don't know how to be healthy. I think people know, but as you point out, some of these things are just so pernicious. They're in our environment. It's almost like you're already being set up to fail when it comes to your health. And I think that's really unfair to kind of put that onto people. Talking about COVID, and there was a lot of discussion, for example, about vaccine hesitancy among Black communities, Asian communities in the UK. And again, I felt that this discussion was kind of missing the context of, people may have been harmed by this healthcare system. There may be historical reasons for that mistrust, and dismissing it as, oh, these people just don't understand how vaccines work it's really incorrect. But also it's dismissing people's real experiences. People have experienced racism, and it's important that we approach that from a point of, how are we going to build trust with people and make sure that people do have access to vaccines, rather than treating that as something, dismissing people and thinking that they just don't understand how these things work, because I think that's just not true.
Is there anything else that either you cover in your book or that you're aware of that you think would be worth discussing that we haven't covered?
We haven't talked about as much, but that I think is also important. We've talked a lot about physical health, because I think maybe that's an area where there's a lot of research. But I think also mental health is an area where we see racial inequalities, and I think it's important. It's as important as our physical health. And I think there are different ways that affects health. So I think there's the issue where racism itself, we kind of touched on this, that just knowing about these inequalities and experiencing racism affects our health and maybe our expectations about our health. But I think also there can be racism when it comes to prevention. So, in mental health care, it's something that I also experienced in the past, just trying to access, therapy, just to process things happening in my life. That when I tried to broach topics related to racism or experiences of racism that I was facing in my life, one of the white therapists that I saw was really struggling with that. And I could feel that she was uncomfortable with me talking about racism. And I think that's a big issue that, practitioners need to be trained to be able to tackle these issues, because racism is something that can affect people's mental health. I am based in Germany usually, and in Germany, there's research showing that, many people, particularly Black people, have felt that their experiences of racism aren't acknowledged or are kind of dismissed in the context of psychotherapy. So there was a survey showing that I think 62% of Black people felt that their experiences of racism were not taken seriously in psychotherapy. But there is also similar research in the UK and in the US. So I think that's important because it can put people off seeking care. And that then can contribute to inequalities that we see when it comes to mental health conditions. So, ethnic minority groups are often undertreated for common mental health conditions like depression and anxiety. But we also see, for example, that for Black people are underdiagnosed with depression, but then overdiagnosed with schizophrenia in a kind of stigmatizing and racialized way. So I think there's a lot of dynamics there. In the US as well, we see that there are inequalities in terms of Black people experiencing a mental health problem, particularly Black men are more likely to be dealt with by police and maybe shot by police compared to white men experiencing a mental health problem. In the UK and in the US, we see that Black people are more likely to be detained involuntarily for psychiatric care. This is obviously really traumatizing and is a huge problem that can also affect people's experience seeking mental health care. Yeah, that's my long way to say that I think we should also think about how racism affects mental health, because we know that mental health and physical health are connected. And yeah, these things are all important when it comes to recognizing racism as a public health issue and then thinking about what we can do to address it.
Thank you so much for tuning in. Please do stay tuned for more. Don't forget to rate, review, and subscribe. It really helps the podcast. And follow me on Twitter. Feel free to shoot me any thoughts. See you next time.